not able to watch it. Okay. Okay. I'm not able to see the thing on the YouTube. Okay. A very good evening, everybody. I hope you had the opportunity to watch the short videos that we had telecast right from the morning. It will be available for your viewing till midnight, and also it will be we'll plan to keep it on the website for the extended viewing. So as informed, this symposium is an effort by ACSI to discuss on the recommendations for safe practice of cutaneous and aesthetic surgery in the COVID era. And this article was brought in after a lot of effort in our recent issue of general and cutaneous and aesthetic surgery. So we shall start off with the live panel discussions. Keep your questions ready, and you can post them in the window you see on the right side of your screen. I would now introduce the speakers. Omkar, can you put on the PPT, please? Okay. So first, Omkar, you can skip my slide. We have our president, Dr. R. Raghunath Reddy, with us. He's the president of the Association of Cutaneous Surgeons of India. And I would request our president, Dr. R. Raghunath Reddy, to just talk a few words to the gathering.
Good. Should I now or after introducing everybody, Dinesh?
If you want to talk, you can talk now or later on, whichever you feel better.
To finish introducing the faculty,
okay.
no?
Yeah. Omkar, can we go to the next slide, Omkar? So in our panelists, we have among our panelists Dr. Raghunath Reddy. He's the president of ACSI, and along with him we have Dr. Venkatram Mysore, who is one of our past presidents of both the Association of Cutaneous Surgeons of India and the IADVL. He's also the president of DASIL for the year 2019, Dermatology Aesthetic Surgeons International League. And he has been the ITMP mentor and a field medal awardee. And he's also been the president of the Association of Hair Restoration Surgeons of India. He's got a huge academic background, being the editor-in-chief of the hair transplantation book, and also editor-in-chief of the ACSI textbook of dermatosurgery 2 editions. He also served as the chief editor of the Journal on Cutaneous and Aesthetic Surgery in the year 2010. He's been the associate editor of the Journal of Cosmetic Dermatology, and he's on the board of SkinMed, International Journal of Dermatology, International Journal of Trichology, and the Indian Journal of IDOJ. So he has many papers and books to his credit. He currently practices as the director at the Venkat Center for Skin and Plastic Surgery. Next with us, we have a very, very well-known and popular face, Dr. Shamanta Barua, who's the HOD from the Department of Dermatology, Assam Medical College, Dibrugarh, Assam. He's the current chairperson of the ACSI Academy of Dermatosurgery, and also he serves as the member on the Specialist Advisory Board of the National Board of Examinations. He's currently the vice president. He's currently the vice president of the Northeast States branch, IDVL, and also the joint secretary of Indian Medical Association, Dibrugarh branch. He served as the honorary secretary general of IADVL and also was the Dr. Ellen Sinha Memorial awardee at Democon 2015. And he has won various scholarships at the international level and has numerous publications, presentations, both in national and international conferences and journals. The next of our speaker is Dr. Shehnaz Arsiwala, who practices at Renew Derm and is who's managing director there. She also practices at Saifi Hospital and Prince Ali Khan Hospital. And she is the editor-in-chief of the JACAS, that is Journal of Cutaneous and Aesthetic Surgery. And she also has been the past coordinator and convener of IADVL Special Interest Group Lasers and Aesthetics, and also the coordinator of Focus Group of Aesthetics in ACSI. She has been the associate editor of IDOJ, and also she has a lot of books and publications under her belt. and she's been a constant feature in as a faculty in various workshops for IITVL and the ACSI, and she has presented a lot of papers in both the national and international levels. Our next speaker is a well-known face who is well known for his uh, expertise both in dermatology and the legal field, Dr. Subodh Sirur. He's a senior dermatologist practicing for the past 25 years in Maharashtra, and his interests lies in psoriasis and vitiligo. And he has interest in law with special focus on medical law and clinical trial laws. He's conducted more than 100 interactive sessions for doctors on law-related subjects which are related to medicines. And also he has various publications in many journals and chapters in standard textbooks and also on books on medical law. He's currently the convener of the IITVL Constitution Committee. The next panelist is Dr. Swapnil Shah. He's a very friendly face and well known in Maharashtra and in India for his laser expertise. He was awarded the Dr. Gokhale Prize for being the first in MD exam conducted by the University of Pune, and he has presented various papers and conducted workshops, hands-on workshops and live workshops in various national and international conferences. He is both involved in private practice and also he's a professor of dermatology at Ashwini Rural Medical College in Solapur. So currently he serves as the Vice President of Association of Veterinary Surgeons of India and is the past convener and coordinator of IIDVL Special Interest Group Laser and Aesthetics. And lastly, as a panelist, we have Dr. Savita A.S., who is a qualified dermatosurgeon with a fellowship in dermatosurgery from the Rajiv Gandhi University. She serves as associate professor at Saptagiri Institute of Medical Sciences and also a consultant dermatologist and dermatosurgeon at Roots Institute of Dermatology in Bangalore. She's currently the Honorary Secretary General of IEDVL Karnataka branch and also serves as the academic convener of ACSI from the year 2017. She has been the recipient of the Young Dermatologist Award of IITVL Karnataka in 2016, and she is the co-editor of IITVL Textbook of Dermatology, and she has numerous papers and chapters under her belt. So this brings us to the list of panelists. Before I end up, I will just have a brief introduction of my president. He will speak a few words and share his thoughts. Dr. R. Raghunatha Reddy is a qualified dermatosurgeon. He was the first dermatosurgeon. Yes, sir.
Enough.
Okay.
We have been having this for quite some time.
Okay.
Thank you for introducing all the panels. Thank you for taking all the efforts to organizing this webinar. As you introduced that from ACSI, we formed a committee under the leadership, the presidentship of Dr. Venkatram Mysore and Academy Dr. Shamanta and Dr. Savita. And around 10 of us were there. And we started compiling the recommendations or guidelines from ACSI regarding procedural dermatology in the COVID era. And that took around 15-20 days. And during that time, because it is a dynamic process, the evolving trends and understanding of COVID keeps changing every day. And by the time we brought out that issue, also so many modifications happened. And every day this is happening. So whatever we have written in that article may be relevant that day, and it has come out very nicely thanks to all, especially Dr. Savita, Dr. Chainaz, Venkat sir, and all the contributors and for their contribution. And based on that, today we are organizing this webinar to discuss further, because as I said, that article is not complete in itself, and a lot of new things may be there, a lot of new thoughts may be there. And the elite panelists are all expertise in procedural dermatology. So we will share and discuss specific points related to both the dermatologic surgery, hair transplantation, and aesthetics. So with the introduction, I will hand over to you. Welcome you all for today's webinar. Thank you.
Thank you, Riti, for your words. Onkar, can you just stop the slide sharing and we'll go to the panelist view? So once again, I welcome all the panelists. And as we see, we have a galaxy of stars who are not only experienced dermatologists with a lot of expertise in dermatology, dermatosurgery, but also are leaders in their own right. So we hope to have a very good session. The questions have started coming in. So before we start off, we'll have a few questions from our side so that we understand the situation. I would request the panelists, I would want to know from the panelists, how many of you have resumed the procedures, and what are the procedures you've commonly started off with, and what are you comfortable doing with, or what are procedures which are common more now? Would anybody
Your
want to
voice
take
is
up the
not,
question?
Dinesh.
Yeah, can you hear me, sir, now?
Yeah, improve your voice. It's not.
Yeah.
It's
So
low
what I was
volume.
asking is, I would like to ask the panelists, how many of you have resumed procedures? And what are the procedures that you have resumed? So if anybody could take up this question, Dr. Shamanta, would you like to take up this question?
Yeah. First of all, during the early phase of the lockdown, and especially during the early phase of the pandemic itself, a lot of the sort of elective surgeries were deferred. And at that time, possibly the only procedure that I was doing was mainly biopsies, and that was with regard to diagnosis, especially in cases of, say, vesicobulous lesions. So that was the only procedure that I was doing at that time. But of course, now once the lockdown has been relaxed and the guidelines have evolved, and so now I do certain procedures like, say, intralesional injections therapies, peels. I have also done a few nail surgeries of late, and excimer laser and phototherapy have resumed in my clinic. So these are the few cases that I've done. And plus, there has been a couple of cases where I had to, I have done Q-switched Nd:YAG laser for, of course, non-facial body tattoos. And that is in a case which has already been with me for follow-up for quite some time. But if you ask me, I haven't actually taken up fresh cases for ablative or other laser therapies as far as possible.
Good, sir. Would you like to add on, like, what are the procedures which you have resumed and
Your
your
voice is not. Still
Venkat, sir, would you like to add on what procedures you have taken up, and what are the procedures more commonly being done now in the last 1 month or so?
The answer to this question depends upon where you practice. If you practice, at least till now, in a place like Bangalore, where till last week we had a very small number of cases, very few deaths, the attitude would be different. And if you talk to Shahnaz in Mumbai, what the answer she gives will be different. So there cannot be one answer to this question. But coming to ourselves in Bangalore, I'm talking of as on now. And probably it is going to change, as Raghunath Reddy said, every day it changes. And in Bangalore, there has been a sea change over the last 1 week. In 1 week, it has doubled. From around 700, we have reached 1,500 with a death rate of nearly 5, which is quite high. Probably it is going to change. But anyway, let me tell you what we have done so far. From around May 17th, when we first opened, we have practically done every procedure. And there are a lot of precautions which we are going to discuss over the next 45 minutes or 1 hour. We have done about 8 or 9 hair transplants, about 5 liposections. Aniket has done about 3 or 4 rhinoplasties, about 4 or 5 fat transfers. And then we have done lasers, all types of lasers, including tattoo, fractional laser. And we'll explain how we have done that with respect to precautions. But the point I want to stress here is there is no one answer for the entire country. It depends upon, for example, in Mysore, for nearly a month, they did not have a single case. So obviously, people will be emboldened to do anything that they normally do. So that is the underlying point. The number of cases affects the way you treat patients, and more importantly, it affects the psyche of everybody. Now, in the last
true, that is true.
Many doctors have got infected. There has been a hue and cry that beds are not available. Then naturally, you will not think of doing procedures. So this fact has to be kept in mind. But as I said, coming to ourselves, we have practically done everything.
So I'm given to understand that all the panelists are resumed doing the procedures, and basically the number of procedures or the load of procedures depends on the area we're practicing, where if you feel if it's very high, it would be a little bit difficult. I would like to hear from the panelists, have any of your patients turned positive like after doing the procedure, they go back and then you get to know that the patient is turned positive?
Fortunately, no. Not
Fortunately, no.
Okay, some of my patients have turned positive after consultation. So because I just wanted to hear. Okay,
I will tell you what happened in one of our cases. See, when we started doing hair transplant, we took a policy decision that for nearly 2 weeks, we will not give an appointment for surgery. And for those 2 weeks, we will follow up the patient. And the patient had to be from Bangalore only. This is something which I adopted after listening to a speaker from Wuhan in China in one of the ISHRS webinars. Now, this patient came to us on 12th of June, and we gave appointment for surgery on 26th. And we asked the patient to get tested, COVID test, RT-PCR, just 2 days before. It takes 1 or 2 days for the test result to come. So he got tested on 24th evening, and 25th morning, which was yesterday, he rang up saying that he has tested positive, and then he has been admitted in a district hospital. Now, the reason why we took that 2 weeks is we have not seen him after 2 weeks. So the district health office followed up with us. Then we told him we haven't seen him in the last 2 weeks. That means we are spared of any quarantine or any other such issue. This is the reason why we took that decision. And because in hair transplantation, you are in contact with the patient for a longer time, very close to the central part of the face, number of people involved in the surgery. So because of all that, we took the decision. This is not practical for every other minor procedure that we do. But for anything that you do as a surgery, wherein there is some exposure other than usual, out of ordinary, such a policy will stand in good stead.
Sir,
Okay. So,
today I was speaking to one of my friend who is head of the department in ENT. He said all the cases which they are testing for cold and regular cases most of them are turning positive. Is there anything related to standardization of the kits or methodology which is giving false positive results? Anybody?
Or maybe the cases are increasing.
Yes, because RT-PCR is
highly infectious.
It's just for the nasal swab. It is just 30% to 40% sensitive, and if it is still picking it up, that means we have a huge number of cases.
Yeah, the contagion is high, and
So
it is a really highly contagious virus.
So how easy is it to get a test done? Because ICMR is not made it mandatory. So unless you have symptoms, you cannot really go get a test done. So how easy did you find getting a preoperative test done for the patients?
Sir, I heard a lot of stories that those patients, genuine patients who have symptoms, frantically trying to get tested in Delhi, but not able to get through testing even in private hospitals for a week or so. So in this situation, how easy it is for a condition like this for elective procedures?
So
yeah, anybody could answer that question on the panel.
Dinesh, my suggestion is in a webinar, don't say anybody because it is a little difficult to see. Please.
Okay, sir.
Yeah.
Okay, so you could take up the question, sir, because you said
Venkat sir and Swapnil wanted to add something.
See, now, as far as preoperative testing is concerned, it has not been difficult at all.
yes,
So there are three private laboratories in Bangalore who do it. They charge 4,500 rupees for the test, 1,000 rupees for PPE. They go to the patient's home and do it. And in fact, in 2 of our staff, one lady got a little fever. She stays in a hostel above our clinic. So we were a little alarmed and we got her tested. And fortunately, we have 2 centers. So we have divided the staff that there is no interaction between these 2. We did that deliberately because we didn't want intermixing to happen. So in case one center gets quarantined, other center can continue to function. They're actually side by side. So this lady, we got her tested. By evening, the report came. But this is in private. But let me also tell you the experience in government. One of this front office staff had gone to Hassan, which at that time suddenly had lots of cases. It was marked as a red zone. Now she stayed a little more, 2 or 3 days there. And when she came back, we wanted her to get tested. And when we sent her to the ACSI hospital, fortunately we are covered by ACSI scheme. So we sent her there. There they said, we will admit you while waiting for the result.
that's
Those who are testing positive or negative, suspect, everybody gets admitted. We were alarmed by that. So we said, you quarantine at home, we'll observe you. If you develop symptoms, we'll test it. So in a government facilities, still it probably takes time, but privately it is available. So it is not all difficult.
okay.
Yeah, that's right. I think when the patients are tested in a government setup, they're usually kept in a facility until the test comes negative, and then they are allowed.
But that policy keeps changing, Shamanta.
No, sir.
Depending upon the caseload,
Sir.
every state government is changing the policy. Sometimes they say institutional quarantine, sometimes they say hotel quarantine, sometimes they say house quarantine, home quarantine. So it is a
No,
No,
I'm
sir.
talking about.
It is now being standardized, sir. I mean, there is no confusion whether you do it in a private or you do it in a government. Now they don't admit you right now. They'll ask you to self isolate or self quarantine at your home if you have a good facilities for 3 days till the report comes. And once the report comes, the further actions are necessary. Now it's been standardized, and now anybody can go and ask for the test, like especially for the pre-op, whether it's in a government or in an ops private, they'll do it, sir. They just will not say that no if you say pre-op testing. And second point I want to make is, now from today onwards, government of Maharashtra at least has officially announced all the ELISA tests to be done in private labs, and they are now allowed. It's basically for not for the diagnosis for it, but to know the sero prevalence. So the good idea is to get a test done, wait for 7 days, and get another test done. That will be turn out to be more cheaper than RT-PCR, at least as dermatologists are concerned.
True, Dr. Swapnil, I concur, because at some places they are going a step ahead, and even if you're positive, they're asking you to quarantine at home itself if the facility is good, and the health worker regularly visits you to check on whether if you develop symptoms, only then you're taken to the healthcare facility.
Dinesh, can I add here? Dinesh, can I add?
Please, Dr. Shehnas, yeah.
Okay. So there are two things here. First is, as you all know, Bombay has had a volatile outburst of infections. Our initial rise of infection happened from mid-March to mid-April only. During that time, the government released a rule that the testing should be done only for patient has sore throat, cough, and difficulty in breathing. All these three symptoms should be present for you to test. So if you will only have fever and you do not have cough or difficulty in breathing, you were not tested. Then from mid-April to May, there were more kits available, and so more patients were getting tested, and the private labs had a little more say, so we tested. I shut my clinic till middle of April. I started work from April onwards, and during that time I just did consultations. I started skeletal procedures. Two things I faced is, one, a routine patient whom you wanted to do a procedure, say like a PRP, or maybe any semi or partially invasive procedure, you were not allowed to test, because by the time we were ready to test everybody, the government came out with a rule that if you are going to just write a test, then your license can be revoked. So that rule came in when we wanted to test our patients, and we could not do it in elective.
Did you face any situation where a patient asked your report?
Not yet.
Or your stuff?
Not yet.
Not yet. Okay.
So like we treat our patients with universal precautions, patient has to treat the physician also with universal precaution. The onus lies on the entire community. So whatever rules fit for us, they should fit for the patient.
Yes, fortunately, we have been doing all the procedures, but none of them asked that question. But I hear a lot from other specialties, like pediatricians, when they bring the baby to put it onto the weighing machine, before that they are asking, have you cleaned it? Have you got your tested? And because so maybe they give a lot of importance to that segment when it is a infant or when it is an elderly person risk. People are aware now.
Yes. Also, there's so much social stigma to the testing, because they feel I'll be quarantined, I won't be. So there is refusal on the part of a patient also to test himself electively. They rather defer the procedure to a later date rather than get a test done for a procedure. So that's the scene in Mumbai.
Dr. Shamanta, I just wanted to check on you whether we are talking about using disposables during the procedures as much as possible, the lasers or the peels, the cups, brushes. Do you think it's a good idea that we use disposables, or can we just sterilize and use them back?
I think we can very well sterilize and reuse it, especially when it comes to the laser tips and the laser probes. So that can be easily sterilized with the common disinfectants. For the probably the larger body of the lasers, you can go for the sodium hypochlorite solution, and the laser optics can probably be taken care of by isopropyl alcohol or even glutaraldehyde. The same will apply for other the RF tips. Probably again, glutaraldehyde is better than isopropyl alcohol, which can be used for the other accessories. And as far as say for peels, it is best not to use the brush. Preferably, I will prefer to use the cotton balls as far as practical, so that I need not use the brush. Need not have. I did not bother about reusing the brush. And coming to, you said cups, was it?
Yep.
Yeah, so those can be sterilized pretty easily with isopropyl alcohol or glutaraldehyde. So I think the question of using disposables wouldn't apply as much, provided you take other measures for sterilization.
Dr. Shehnaz, would you want to add a bit on it?
Yeah, so as Shamanta rightly said, you can either use isopropyl alcohol, glutaraldehyde, or you can do an ETO sterilization, or you can autoclave your instruments.
Yeah, and now botulinum toxin is also low or to moderate risk procedure. So especially when done on the upper face, so you just have to cover up the lower face of the patient and go ahead and do the botulinum toxin. So what about fillers, like especially when you have MD codes? How would you stratify fillers, the risk of the fillers, and is it possible, or you have to remove the mask and go ahead and do it? Because we have with the MD codes fixed points.
Yeah, so if you see, there are four factors, as we say: the physician factor, the patient factor, the surfaces, and the instruments that you use. So the room sterilization method, like you can use a mist or a hypochlorite fogger to disinfect the room. So sanitization of the room part is taken care. The physician can wear a.
No, I'm asking about botulinum toxin. Botulinum toxin.
Yes.
And MD codes.
Yes. So the MD codes can be very well done, because the only part of the face which will be open will be the nose and the mouth of the patient. The physician can be in a full PPE with a face shield. The material that you're using is pre-sterilized, pre-filled syringe. Most of the work is done with cannulas, which are also pre-sterilized. So and you're getting a patient's history at walk-in. So till we get the antibody test, I think if you're taking a universal precautions, fillers can be done, and I have done that.
Okay. Dr. Swapnil, like since we are talking about doing on the face, any experience or you want to share a thought about nostril filters?
Yeah.
Like, is it safe to use nostril filters, because it just covers your nostril instead of covering the full?
Yeah, but these filters are basically available as nano filters. They are being designed by IIT Delhi people, I think, and it's basically for the nasal allergies. The only problem is they are very effective in filtering. We know that. But how effective they are for the expired air, I mean, the air which is released during expiration, we don't know that. Actually, there is no documentation from them. So they will be safe for the patient. How safe they will be for you is not known. I am using it for my patient, because they are very easy and it adds to safety. But the line which they mention in these nasal filters is they are self-cleaning because of expiration. So when you expire, the particulate matter is going to be forced out.
Okay.
That's the recommendation. What is
the cost, Swapnil?
It's around 60 rupees for 6 filters. So 10 rupees per filter. It's not very expensive.
What is the name? Specific name?
It's Nano Filter, sir. Nano Filter.
Nasal nano filters.
Nasal nano. It's available.
They use largely for allergies.
It's largely used for allergies, and they filter out more of particulate material. As one of the studies by one of the manufacturers.
Sir, all filters out particulate material. There is no separate virus.
When you said it is for the safety of the patient, which means both patient and doctor should use. So it is not to the safety.
Anyway, we are using masks, sir.
I know.
This problem arises when you want.
In spite of that, it adds to it.
Yes, of course.
Additional protection.
So no, the problem is when you treat the lips and the chin area of the patient, where you can't ask the patient to wear mask, or it's very difficult to use the mask. So at least some protection is there, like use a nasal filter, which will at least reduce the viral.
Okay.
No, that's what I was trying to say is, as all the masks or filters are particulate filters, one study by one of the manufacturers says that they filter only up to 80% of the ultra low sized particles. and
Yes.
coronavirus is in the range of around 120 nanometers. So we just have to keep a very open mind on that. Dr. Swapnil, I just want to continue with you
Dinesh,
because yes, sir.
Dinesh,
Yes,
please
sir.
engage Dr. Subodh and Dr. Savita, everybody.
Yes, sir. Dr. Swapnil, I just wanted to add on lasers. Like we've been like lasers have been idle for some time. So how do you maintain the machines during this period? It's a crucial time. So there is some amount of disuse. So
Yeah.
what are your views on it? And also it's been a stressful period with AMC and EMIs. So just throw a little bit light on that.
So that's very important question. So there are three aspects of maintaining the lasers. Like when they are not in use for a longer period of time, the plugs should be removed. I mean, that means the laser machine should not be connected to the socket if they are not going to be used for a long time. That's the most important one thing. Suppose the machine is idle for more than a month, it is best to change the water, the cooling water in deionized water, which almost all the machines has, barring few. It is best to change that water before restarting the machine. And it should be kept, if you are not going to use it for a longer time, and if there is a chance of dust accumulation, it should be wrapped up and kept it till you are going to open it up for the using. That's what I did for almost 2 months to 3 months, and now I have removed the wrap and I use it. Because if something goes wrong about them, the technicians are not going to be readily available. They can't come to you for any service, any queries. The services are restricted. So I think electric hazard should be prevented from removing from the sockets. The dust hazard should be prevented from wrapping it up, and the corrosion hazards can be prevented by changing the deionized water. And it's very simple. You can do it on your own. These are the three basic things which one has to follow during the laser.
Okay.
Also, I can add here that the sodium hypochlorite mist or the fog spray that we do. We have to be careful about the laser systems.
See, any disinfectant which you are going to using should not be sprayed on laser. You have to wipe it off with whatever the antibodies.
The surface laser body should be mopped or wiped with a
and the laser room where you are keeping the room, you should not use the fogger. Like a lot of people say that I'm using the fogger, but not be used in the room where lasers are kept, because the fogger can penetrate the exhaust windows of lasers and it will induce some reaction to the electronics, and it can cause a problem. Also, yes, sir.
No, please continue. You want to add a point?
No, that's what. And if you are using isopropyl alcohol, that's a flammable thing. Like again, if you use it as a spray, and if it goes into the laser and you start up the laser, that electrical hazards can happen with that. So have to be wiped out, clean. That's the only solution.
Yeah. In our article, we have mentioned that contact cryotherapy is a safe alternative compared to the ablative radio frequencies. I would like to ask Dr. Savita. Dr. Savita, what about the spray which comes out of a cryo spray? So can you share your thoughts on that?
What we mentioned was, compared to cryotherapy is safer than radio frequency ablation, and contact cryo is better. See, in cryo spray also, there is no aerosol. It's the spray, the cryo, which is coming. So that is also safe. It basically depends on the procedure and what case we are doing. So I think both contact cryo as well as spray, both are safe.
Dinesh, maybe it is mentioned in one particular section, but it's not a generalized statement that contact cryo is safer, because individually we do a spray technique, except in very few places where we do contact cryo, and the effectiveness of achieving the sub-zero temperatures to the effective destruction is less with contact cryo. So invariably it is the spray technique we use. So cryo, because it freezes the tissue wherever you're doing. So there is no possibility of aerosol. What aerosol you are getting is only the liquid nitrogen, which is not come in contact with the skin.
Yes.
So this will not be a problem.
Okay, sir. Thank you. Thank you for the clarification. Dr. Subodh, we were discussing a scenario where one of the patients of Dr. Mysore turned out positive and he was quarantined. But as we are going ahead, there may be home quarantine happening. And if a patient insists on getting a procedure done in spite of being positive and we turn them down, or we turn down a patient who's we are suspicious of being COVID positive and not getting a test done. So can the patient sue us for shutting down a procedure?
Patient can sue us for not doing the procedure.
Yeah, fixing an appointment and then turning back.
No, it's basically your professional judgment. If in your judgment you feel that this procedure should be postponed or it should not be done at this point of time, or you are suspecting the patient to be having COVID-19, then it's your professional judgment. You can postpone the surgery even if you have given an appointment.
So the doctor remains in firm driver's seat. Is there any
Sir,
specific
Subodh
points
sir.
with?
Yeah.
Subodh sir, suppose if a patient undergoes an elective, a non-emergency procedure, whether it's a laser or a surgery, and if he comes out positive later, if he accuses that I got this infection probably from this clinic and they were not tested, the doctors, what will be the implication? He may not be able to prove, but still in the no government level, will they take some action or will they do something?
Accusations of this kind are likely to come, and many people would like to make these allegations. But as you mentioned, that it's very difficult to prove because the source of infection is difficult to identify. We can't say it must have come from the clinic. We know it's a pandemic. We know that more than 70% cases are asymptomatic. So while the patient is coming to your clinic, he could have got it from any source. He could have got from
In such a situation, that means we have to get tested, and if you are tested negative, that means his claim is wrong. Will there be a situation like this if somebody goes to a court or asks that I saw doubt? So will these doctors be in this center be asked to do the test?
No, not necessarily. See, what we need to prove is whether you are following universal precautions or not. You have to treat not only as Shehnaz also mentioned, that not only that every patient could be a potential a person with the infection, or we also take precautions so that there is no transmission to the patient. So in such a scenario, if you can demonstrate that you have been taking all these precautions, I also suggest to some of my clients that you keep your registers, even if it's your private clinic, where you are doing the disinfection on a day-to-day basis. Uh, that which housekeeping person has done this particular disinfection. All these, if you demonstrate that all these factors have been taken care of, you are following universal precautions, there is no way that this case will stand in a court of
So it's a good point that we have to maintain a record of all the safety precautions we are taking.
correct.
Good.
Actually, somebody had also advised me that you keep the bills of all the PPE and the
Correct.
sanitizers that you have purchased.
That all also I advise a lot of people that you keep all this, because the
Now
number
that
of
we are getting complimentary kits from pharma companies. Lot of them are
Now you
coming.
purchase some.
Huh?
You purchase some.
Okay.
Yeah, Dr. Sirur, I would want to ask you whether we should add any special clause in our informed consent, and also in the documentation, should we be concentrating on any specific points?
Okay. Before I go forward on this, let me tell you that this concept of informed consent has been, explained by Supreme Court, where it said that informed consent, in the strictest sense, is not required in a country like ours. In places like America, where US, where you have to explain every detail, should be explained in that. That's called as an informed consent. In India, we adopt what is known as real consent. What you need to explain is not every detail, every possibility that may happen with a procedure. The important things are what infections can happen, what are the alternatives of the procedure, what are the substantial risks with the procedure. Otherwise, even death can happen, anaphylaxis can happen. You may not explain all the fantastic possibilities that can happen with this. What you need to do is give the substantial risks that are there, and you also need to explain in the consent that we are all aware that there's a pandemic and the source of infection could be from various sources, and we are taking all precautions, universal precautions. Despite this, there is a possible risk of transmission of infection. You don't need
Now,
to add anything much more than that.
okay, and should the point that counseling was done to the patient just be made a note in the documentation, or do you
Of
really
course,
need to
of
record
course, of course. I would also suggest you have something like a a patient information sheet, uh, and then give the consent form to be signed, and you record that the patient information sheet has been given to the patient. So that would also help.
Okay. I want to get back to Dr. Shamanta. He was telling that he started off with intralesional steroids. Now, intralesional steroids have a depot effect. Dr. Shamanta, how comfortable are you with the COVID era with the depot? Just we would like to hear from you.
Okay, I think the two main concerns with intralesional steroid would be, number one, as you said, it is the depot preparation. So definitely it would persist. I mean, there would be some HPA axis suppression, which will persist for some length of time. And this would then possibly reduce the immunity of the patient concerned. But these so-called risk, would basically be applicable only to certain set of peoples, like the elderly with comorbidities who are at high risk of having COVID, and also possibly having more severe COVID that leads to mortality. But for the majority of the population who are otherwise healthy and otherwise with good immunity, it wouldn't matter as much. Having said this, I would still prefer to probably defer in cases which can be managed topically for some length of time. But in situations where patients are already on follow-up, then possibly I don't see any reason why we can't go ahead with the intralesional therapies, of course, with due precautions.
Okay. Venkat sir, so you said you have done few hair transplantations. So do you think we can still go ahead and be doing hair transplant in spite of it being a high risk? What about the mega sessions where people do it for very extended periods of time, going for large number of transplant?
Now, let me just explain, taking off from what Shahnaaz said. See, there are four things that you have to take care. The patient, physician, place of procedure, and the procedure itself. You have to prevent the exit of the virus from the patient. You have to prevent its entry into the place, and the place should not harbor the virus. You should prevent the procedure from facilitating the entry of the virus or altering the status of the patient. And of course, finally, you should prevent the entry of the virus into the physician. So these are the four things that have to be done here. Now, coming to the patient, what we do is, I'm talking of minor procedures here. Once the patient comes, generally the patient is somebody who has been doing the procedures already. New procedures, we are still quite reticent. As I said, it is something which we observe for at least 2 weeks, unless it is a very minor procedure. Then once the patient has done this, the consultation, patient is given a betadine gargle and a betadine nasal spray. Betadine has been shown to have some virucidal effect. The ENT surgeons are routinely using it. Dental surgeons are routinely using it. It is quite easy to prepare it. And then we have prepared it. Gargle is available. 2% gargle is available. It is very bitter, of course. It's not a very pleasant thing. And then the spray can be diluted from there. In fact, we have sent it for publication also. So this is one thing which is done. Then after this, patient always wears a mask, some kind of a cover for the nose and the mouth. One is the nasal filter, which I think Swapnil was talking of. It is true that it is basically for allergy, but the company claims that it is equivalent to a N95 mask.
N95. That's true.
Yeah. Whether it is true or not, nobody knows.
No,
I don't
it's a
tested for that.
thing.
But what can be done is further, you can cut a small piece of an N95 mask and stick to that filter or stick it to the nose itself so that the exit of the virus is prevented. Then you can, if you want to cut the central part here, you can either cut or fold a triple layer mask or even the N95 mask, put a double stick tape on it, and then that sticks exactly to the center. In fact, this we sent for publication. It has already been accepted in the dermatological therapy also. So that allows you to do the procedure on a large amount of area. So three things. One is the betadine gargle and the nasal spray, then the filter, and then on top of it, this particular mask. So that allows you to do a lot of things on the face. And then on top of it, for all ablative procedures, we have designed a special acrylic box. I have shown it in many webinars. We also sent it for publication. This acrylic box was first designed by a plastic surgeon in Kerala. It is something like a hood. It is transparent. We modified it slightly. What we did was that there are two holes on either side, and the holes are covered by silicone material so that it sticks and it sits on your hand like this, and you wear a glove on it. So nothing much comes out. And on one side of the box, it has got a silicone sheet with, it's like a curtain, two curtains overlapping, so that in between you can introduce a laser handle. And then in one of the holes, you can put in a smoke evacuator with a HEPA filter. And so the entire procedure goes on inside this hood. And then once it is done, you take it out and clean it with sodium hypochlorite or any other solution that you want. This will make almost every procedure possible. In fact, we tried it for hair transplantation also, but that it doesn't give the freedom for the hands to move in whichever direction you want. So this is how you can do most of the procedures fairly safely. Procedures on the legs, procedures on the foot, they are far away. You can follow social distancing there. It's literally about 1.5 meters away from the nose. On top of it, the nurses, the physicians, they should use N95 mask. In fact, we make them use two masks, a triple layer mask on top of an N95 mask, and then the shield, a cap, then a gown, all those things which normally everybody uses. I personally, and for surgery, we use 3M respirators, which has got a filter, HEPA filter in it. So every implanter, we have five HEPA, those kind of 3M filters. We all use it. By the way, I'm above 60, so I don't do any of this. I'm only talking. So my son does hair transplantation, all those procedures. My daughter-in-law helps him. And of course, my fellows do all the other procedures. So I just supervise. We tell the patient that my job right now is just supervising.
And you will be supervising. Please continue. Please continue, sir. I will talk later.
Well, as far as hair transplantation is concerned, one rule I already explained. No appointment for 14 days. Follow him up. In between, my nurse keeps calling or my front office keeps calling. How are you doing? What are you doing? Like that. And then 2 days before COVID test. And then once it is coming negative, immediately we do the surgery. When he comes to the clinic, he is given a bath. Patient has to take a bath. He changes his dress. He does the gargle. He does the nasal spray. Given a different mask, not the one he's wearing. And he's total dress completely. And once we go inside, we try to finish off the session in that session. We do not do it, or 8 hours or 10 hours. We have never done that really. We usually finish off most cases, maximum about 2,000 units. You don't generally like to do more than that, so that patient doesn't go out frequently. There is no lunch which is given. We don't want to order lunch for anybody from anywhere. And we have 2 theaters. So the arrangement, dissection, everything is done in one. So that avoids crowding. So only the implanters, 2 people are here, and then rest everybody sits in another room. And FUE, whether it causes aerosol, was something of a debate. Now, by and large, it is fairly well decided that it doesn't cost much of it. And let me tell one more thing here regarding the ablative. This is something which I have studied in great detail. And we also had a webinar in our center with all my fellows presenting on different aspects of it. We had Aruni Namdar and Prabhakar Sangolli to discuss it. We even had Nitin Dipe and Sanjay Aurangabadkar as experts for it. See, the COVID, which is supposed to attack to that ACE receptors are present everywhere. It is there in skin only in the basal layer. It is not present above that. But virus has not been demonstrated in the skin in any study so far. And then virus has not been demonstrated in the endothelium also. All the skin lesions that we have, virus has rarely been demonstrated. So whether the virus is present in skin to be able to come out through an aerosol procedure, it has never been proven conclusively. It's a possibility. It remains at that. So, and then of course, we have all these precautions. Then we, of course, our procedures produce a lot of heat, which may be inimical to the virus as it comes out. So with all this, the risk of aerosol is extremely very small as compared to a mechanical drill, what is done in those major procedures in orthopedics or neurosurgery, things like that. There, the amount of the aerosol which is generated is much, much more. Here we are doing little bit of work. So we felt fairly confident after a lot of consideration, lot of studies, lot of reading, that we could do it with all these precautions that I have explained to you.
Okay, thank you, sir. Reddy, sir.
One question. Sir, you said you will be keep calling patients for 14 days in between, but how truthful they will be to give you the exact this thing that they are not going out? Actually, we can't trust people. We can only to some extent rely on that.
Now, see, one of the things which is happening in Bangalore is the IT sector is getting
Working from home.
It is not affected. So they are the ones who are seeking this. And then they are all working from home.
Yeah.
And they are also generally well aware.
Okay. Dinesh, you were asking something?
Yes, sir. You run a center with many dermatologists under you and a good number of staff. So what has been your personal experience in the last 2 months? And would you share any changes that you would have incorporated in your practice, in your setup?
See, I keep talking every time to them and keep reminding them about the safety. Don't come close to the patient unless it is necessary. We have adopted in the reception what is to be done, triage what is to be done, and we will not allow more than 2 or 3 patients. The reception area is larger, so the patients never get crowded. And I keep on reminding my staff, don't take it easy. Even I keep on reminding Savita, she's very bold. I keep on telling, no, wear your mask, wear your face shield. Don't go very close to the patient while explaining, maintain a distance. So I keep reminding my staff because we are human beings. Don't forget, Venkat sir was explaining, especially when somebody is doing hair transplantation for hours together, you get involved in the procedure. It is humanly possible that many times we forget about these things, subtle things. So somebody like, as Venkat sir saying, like us, we have to keep on telling, reminding our staff and doctors not to neglect. Basically, we can't avoid. Now, all of us agree that we have to do procedures. Everybody started doing. Try to understand, as Venkat sir said, what are the possibilities, how you may get infected, what are the chances, and try to prevent and avoid. So negligence, there is no scope, but we can't avoid everything. We have to do it and survive.
Dr. Shena, since you are practicing in Mumbai and Mumbai has got a heavy load of cases, as Dr. Venkat was telling, he was suspicious of few of his staff turning out positive. So can you share us your insights on how to deal with the staff, like, because you have no role on the staff, their families, where they go. So how do you keep them at a safe
So what we do is first is when I started off in mid-April, for first 15 days I worked alone. There was no staff ready to come to the clinic. Someone's spouse said that I can't send you. Someone's dad said I can't send you. So we had no staff, just maybe a person, one single receptionist who was ready to come in. We started off with very skeletal staff, and then as we started getting more patients and doing more procedures, gradually after the initial hype and the fear regarding the virus died down, then by mid-May we were almost getting regular patients coming into the clinic. All these patients are largely more of dermatological cases rather than cosmetic cases. Cosmetic cases were more happy doing their consultations online. So we did a lot of online consultations. In the initial part, when we did the online consultations, we found that patients were comfortable. For those patients whom we needed to see, then we opened up the clinic and then we got them into the clinic. For staff care, what we did is we would, monitor their temperature, and we would every day deeply inquire about any history. And in Mumbai, by the time we had containment zone areas, so If your zone has a case, then the entire zone was sealed. After 1 month, the rules change and only the building used to be sealed. After 1 month, the rules change and only the floor would be sealed. So if you are in a containment zone, you are not stepping out. So we had, we were comfortable. For any staff who gave us a potential history of fever or sore throat, we would give them a, 1 week off in the beginning. And as the government rules change, and the current rule is that they are discharging you from the hospital in 4 days and 1 week of home quarantine. So any potential suspicion, we would rotate the staff and give them 1 week on and 1 week off. So that helped us to manage whatever little bit staff without putting them at risk and without putting us at risk too.
Yeah. Okay.
Sir, Venkat sir, do you have CCTV cameras in the OT, hair transplantation OTs?
Yeah, we have.
Okay. Sir.
We have.
Because there usually you do only, suppose if it is a OT where we do all other procedures where there may be a possibility that patient's body is exposed, then we should not have CCTV cameras inside the OT.
Hair transplant OT we have, because in fact often people ask, we want to see what is being done. Sometimes the relatives ask, we want to see that. In fact, I remember there is one surgeon from Australia. We in fact published this. He had put a TV on the floor so that when the patient is prone, he could see his procedure. So that kind of thing people have done. So it is somewhat necessary. So hair transplant OT has it, but other places, yes, we can't do that. There are so many other procedures that we do where the patient's privacy will be interfered with. So we can't obviously do that.
Fine, sir.
Dr. Swapnil, have you raised the price of your procedures since you have to factor in additional costs? And by what percentage if you have raised? Or
no, I didn't raised any cost. I don't think so we can do that also. And honestly speaking, the cost of our PPs are not much. If we take as a total procedure, you don't change the PP for every single laser procedure. It may be true for hair transplantation, but for the laser procedure, we use the same PP what we used anyway. So I don't.
Swapnil, it will be difficult to pool all the patients for a procedure for a particular period and use the same PP, or you remove the PP and reuse the same PP again. PP.
Honestly speaking, I go into clinic, I wear it, and I remove only when I come out. So in between, I do the procedures also, because we don't need the PPE of what we are considering as an
so
COVID.
You're using that something called HIV kit?
It is better than a HIV kit. I mean, it's not exactly an HIV kit. It's a washable PPE which you can use it. It's not absolutely sweat proof or waterproof. It is still a porous. It is, but it's good. I mean, at least it is like in other words, it's like a surgical gown. I mean, it's not...
Can I add here?
Yes,
so what I do is I use washable or reusable PPEs, and I have a potential fear that if I use PPE for one patient and I'm getting into another room for another procedure, I don't want to use that PPE. So we have a set of 3 PPEs which is each doctor has, and we rotate in them. So if I've used a patient A one PPE, then I would change out of that PPE, put it in the hanger, and put it in a room where we put the fogger on for 10 minutes. So the mist from the sodium hypochlorite will settle onto that PPE and the surface will be desanitized. In the meantime, if I have another patient, I would wear another PPE. So we rotate our PPEs, and once in a week, we also ETO the PPEs.
Sir, can I add something?
Yeah.
Like the fear of fomite transmission has to be taken over now. It's been well conclusively proved that fomites are not a major source of transmission for COVID. It is directly aerosol, direct contact with the patient, the social distancing and mask. So what I do is I just wear a washable PP when I enter the clinic. I use the N95 mask and an acrylic face shield, which is in front for the patient. Whenever I do the procedure, I use that 3M mask, because the problem of 3M mask in OPD, they are very extremely comfortable, but you can't talk clearly with the patient. The voice is always muffled in 3M mask. That's the only disadvantage of 3M mask. Otherwise, when you use the 3M mask on your face and go to the clinic, I mean, that's sufficient to take most of the problems, which is solved. Like initially, I spoiled entire furniture of my hospital spraying hypochlorite spray, honestly.
Yes.
And then, and then I realized what I'm doing. I mean, the
Even
patient,
you wasted my money for buying that
yeah.
spray.
So what I changed it from hypochlorite to bacilloid now, glutaraldehyde.
No, I am using that machine in my farm.
But sir, see, sir, we are not only the surgeons. I mean, our bulk of the OPD is still dermatology. And,
Sure.
and in a busy day, however restrictive you are, you just can't refuse and ask the patient and go out and sit. He will start fighting there and there only. And the fight generates more fomite than allowing him
Yes.
to sit in the clinic. So it is.
No, but what about anybody? Has any of the panelists raised the prices?
No.
Dinesh, yeah, may I say, I find it is very difficult because
I know.
it's something like this. We are in a situation where we are incurring more running cost, less number of patients, we are financially burdened, but the same thing is also applying to all patients who come to clinic.
Correct, sir.
So they don't take it, they don't perceive it very well, and they take it in a very bad this thing. So I don't think we will be able to even change 1 rupee from our previous stated charges.
The good idea will be, if you are doing a hair transplant or liposuction,
Yes,
prescribe the
then
people
you
to
can
the
add,
patient. I mean,
but not
prescribe
for consultation and routine procedures.
No, you can't.
Yeah, in fact, they ask for concessions, and
Yes.
in the current circumstances, people have lost their jobs and all. So we honor that. When they ask us for a concession, we pass it on.
But if they're coming for a cosmetic procedure, I'm sure that they can afford it.
Yes.
They can afford, but
Yeah,
still,
even if we are
still-
suggesting a postponement and they
Yeah.
insist on getting it done.
Maybe-
For a routine consultation, I would say yes. You could.
yeah, but
probably give
also
them.
cosmetic procedures can be done at routine pre-existing charges. There's no reason to raise it.
There is
Yeah,
no reason to
point
raise
taken.
it.
Dr. Savita, you practice both in a medical college and you have a good private practice also. So do you find any difference in the two? What is your insight into this? Like practicing both in a college, the way you practice procedures in a college and in a center?
In college, actually, we had stopped procedures for a long time. We
Agree.
started from last week, and because it's a college anyway, and number of patients coming in the college also has reduced considerably in the OPD. So, and because we're not doing procedures, it's the regular thing. Before, all of us would sit in a big room. Now we are 4 of us in our department. We have spread out to 4 rooms. We see patients individually so that there is no crowding. Even now, one PG sits with one staff, so all of us don't sit and discuss it. So we've started this. Procedures, yeah, we've started now. And my college says charge, my college is charging extra. So each patient, they're asking us to charge more for extra for the gloves and mask and cap. So about 100 rupees extra per patient we are charging for the procedures.
That's fair, ma'am.
Dinesh,
Yes, sir.
I have worked in medical colleges. Don't be surprised that
Yes,
their
sir.
glove, their right needle, their right blade, everything
We have to write,
is
sir.
from the pharmacy. I
Yes.
have never done that in my practice. I just don't calculate. We do it. Savita knows. But these medical colleges also, they are not paying the salaries. For example, they're asking the staff to come weekly once, and they are doing it, and they are paying maybe 20%, 30% of the total salary for them, but they are charging more. This is how private medical colleges work in India.
That's right on target, sir.
Yes. Dr. Subodh, in case a doctor desires.
And one more point, sorry. In fact, most of the private colleges, they are not surviving on hospitals. There are some colleges who spend on hospitals, but in fact, it is a profit for them that their patients are not coming. But they are using all means, because I had to pay my daughter some due was there. Every day I get 30 to 40 calls for that payment due, which was a minimal amount. And the way they spoke is as if they're literally dying. And I told them all these things. In fact, you are earning more. You are getting all the fees, you are getting all the donations, and you are spending less.
Also, I would like to add, I have affiliation with 2 private corporate hospitals. So the scene in the corporate private hospitals in Mumbai 80% of the beds have been taken away by the government for COVID. So there is no elective dermatology work going on. Whatever referral you get is for COVID patients. And the patients are just not willing to come to a hospital setup for a consultation. And that is going to be so for the next 6 months, I believe. So I think those who are having a private clinic are definitely, they are running the meter, I believe.
I have one
just
more
want
question.
Dr. Subodh's word on
Dr.
this.
Shahnaz, Swapnil, you were all telling that washable PPEs and all. It will add on to the burden of the person who does this cleaning job. Washables,
Yes.
to manage washables will be a big burden, because that is also adds to the problem of managing the clinic, and this people who are into this laundry and all will add to the cost as well as to the, what do you?
Yes, sir.
Buy a
So
washing machine.
in Mumbai already we are facing a crunch of waste disposals.
That is a
Buy a washing machine.
Huge crunch, tons and tons of waste.
No,
Yeah.
it's very easy to
It's a fact. Yeah.
wash it in washing machine. I mean, there is
So,
no touch. No,
I understand we have to, it's a medium setup clinic where you have around 20 people, you have lasers, you have surgical procedures. You have,
20 is not medium, sir.
you may have to appoint, no, you may have to appoint one person exclusively to manage all this. Otherwise, it will become difficult.
Yes.
I agree with Reddy that this is a time wherein your expenses are going up. If you look at one individual procedure, one glove cost may be less. But when you look at how many gloves are using from morning till evening by everybody in the staff, that cost is high.
True, sir.
Same thing with everything else. So that is a significant cost which you see at the end of the month. So there has to be some way of recovering it. What we have done is, the existing charges are the same. We have not increased it. We have added small amounts depending on the procedure, depending upon what we do, 250 rupees, 500 rupees, 750 rupees, 1000 rupees, depending on the procedure you raise it, and say that this is for the PPE and COVID because of this. And we have found that patients by and large have accepted it. Those who don't accept, don't pay. And then you consider it as a discount. But don't raise the price, add it as an extra, because they have read in the newspapers that nearly 2 lakhs are for PPE in a hospital. So they don't mind paying you 750 rupees income for that.
It's a good idea, sir.
Okay.
Additional
Dr. Subodh,
cost.
is that legally fine if a doctor decides to raise the price or add an extra to that?
There is no regulation on, or you can't cap the doctor's fees, but the Code of Medical Ethics says that you have to display or announce what your fees are well in advance. So you cannot at a later stage say that, that 50,000 or 20,000 was for the procedure and now I'll charge you extra 10,000. So you have to announce your fees entirely well in advance, and that should be fine.
Thank you. I just wanted to clarify on that. That's what we need to focus, that we need to announce it beforehand to the patient.
Correct.
What about this professional indemnity? All the terms and conditions what we had before the pre-corona, will it hold even for the COVID era?
Yeah, there won't be any change. The infection is not causing any change in the terms of insurance as far as professional indemnity is concerned. It will protect you to the extent of indemnity, whatever sum insured you have taken.
Okay. Reddy sir, I want to ask you one thing. Now, are these good days ahead for consultation prescription practice, or since the procedures are down, do you see, like there were many people who always said prescription practice is what holds you in good stead. So since the procedures are going on the downslide a little bit, so do you see the prescription overtaking by a mile, or do you think the procedures would?
It's not a good thing for anything, whether it is clinical dermatology, whether it is a prescription practice. It's not a sunny days for anything. It's a gloomy days for everything. We can't say that clinical dermatology is doing well. What we can say is, clinical dermatology at least earns us bread and butter now. Those who had a combination practice of clinical dermatology, all procedure dermatology can sustain. Those who had only aesthetic practice and all will be little difficult for initial days. And Dr. Shahnaz is there that slowly they are coming back. Maybe they had reserves as well, so they can sustain.
Sir, if we say this is post-lockdown, what I feel is clinical dermatology is recovering well. I mean, there is no denying fact that clinical dermatology is recovering well. It is around 70% of what it was. The procedural dermatology is taking definitely a backseat. It is, at least in non-metro India, we are just doing 30% of the procedures what we were doing in numbers. So definitely the surgical or the procedural dermatology presently is not doing good, in my opinion.
Okay, Dr. Swapnil, just one more point here on you. Since like we are not doing much of lasers, or probably some places with heavy load were not doing any lasers at all for the past 2 months. Maybe some doctors were extra cautious. In that case, do we have a bargaining chip with the AMC with regards to the laser companies? Did you speak with any of them?
Not really. I mean, I never spoke with any of the laser companies, but there's one good point about the loans. I mean, as we know, the banks are given moratorium, but apart from that, most of the banks are now giving loans on your loans. Like they have something
Loans
called
on your loans.
yeah, yes, but with a very significantly reduced interest rate. Suppose if you have a loan of 50 lakhs, they will give you 25% of that 50 lakhs with an interest rate of 7%, and it's an official government scheme. So generally we take a loan at around 10% or 11% interest rate. Now these loans are available at around 7%, and that is very good. You save 4% of your loan, by which you can actually compensate on these EMIs, because you are not generating anything out of the machine. So at least these 4% are saved now.
But Swapnil, in my experience, whatever bank says that we process in this many days, we don't need documentation. When it comes to reality, they will pester, they will slap.
No. I have taken that in for my hospital, and they are super quick. Actually, they are behind you to take it. I mean,
No, but this 7%, is it confirmed? Because I was told it is 9%.
No, sir. I have taken it for my hospital. It is 7.2%.
No, but did you register? Did you register the hospital as an MSME to apply to this?
Yes, I have registered as it. It's a private limited company, sir.
No. So private limited company, it becomes MSME, is it?
Yeah.
No.
But the loan which you give first while constructing an hospital are given under MSME scheme, sir. What I mean
that is for constructing. If you are taken as
the entire institution is, if I had taken a professional loan from a bank, it is considered as they give it as an MSME loan generally. Okay. So you by default, and now the government directives has come that all the hospitals can be considered as an MSME.
Okay.
This let me just understand that now you can cover instrument loans also.
Yes, sir. That's what they told me. The cap is around 25% of the existing loans.
Okay. And I just want to make a clarification regarding what to choose, who to do, what not to do. In addition to the virus, the fears, the facts, various other factors also make us decide whether to do or not. One is your financial burden of running the clinic. You can't close it. If you want to open it, you want to sustain it, you will take extra risk of doing the procedure. Second, your age. If you are really, as Venkat sir said, you are 65, 70, you may have to give up. And like this, there are so many other factors which come in day in and day out. Based on that, people decide about the procedures in addition to the COVID features.
Also, sir, the social gatherings are not allowed, and everybody is going to be in the mask for the next 3 to 5 months at least. So the face is covered and nobody's going to see you. And I mean, it's a fact. There are no parties happening, no pubs, no clubs, no functions, no marriages, no religious gathering. And you're going to go out in the world in a mask. So the face value for the patient has suddenly, yes.
Shanaz, now you may get a patient asking only upper face, but spare only mid.
Nobody will bother about tear trough. Nobody will bother about melasma.
Absolutely. People have got chance to introspect themselves, accept themselves the
they
way
may come
they
and
are.
ask, ma'am, I want only the forehead.
Yeah.
No, probably I was
thinking of getting into mask manufacturing.
Okay. No. Would we expect a surge in cases, like once everything settles down and we restart our practice, like in a normal way?
My understanding is that until a vaccine or at least an effective medicine where it is proven that yes, we are safe, it will work. For example, we have for herpes virus, we have an antiviral drug, something like that comes out, then we will be confident to take it on ourselves. But the number of cases till this happen is going to increase. Definitely the government will keep on changing their policies to reduce the caseload, to prepare themselves and also to safeguard themselves and to the public. Lockdowns can be still expected in a country like India because 130 crores, overcrowding, poverty, lack of knowledge, all these things considering, it is going to be an exponential rise in all circumstances. So we have to be fingers crossed, and I don't think the days are good till something conclusively happens either in the form of a vaccine or a drug.
Okay.
The sad news is in Mumbai tomorrow, beauty parlors and salons are opening up.
all over the India.
All over Maharashtra.
We
all over
had
India.
hair salons opening up with extra
Yeah.
charges. We just have few more questions to go. Venkat sir, one of the audience wants to know, how do you prepare the betadine nasal spray which you were talking about? Can you please talk about it again?
Can I add, sir? Can I answer this?
Yeah,
Please go ahead.
Yeah. So you get a betadine nasal, the goggles. Okay, you get a betadine goggles commercially available. You take 2.5 ml of betadine goggle, add 2.5 ml of water to it. Out of this 5 ml, with 4.5 ml or 4 ml, make the goggles. 1 ml which remains, you take it in a syringe, remove the needle, and just push it into your nose. They are super comfortable. There are no after effects. I am doing it. This is suggested by Dr. Rajat Gupta from Delhi, and I was following it, and it's very easy. I mean, there is no irritation. There is nothing.
Okay, the Dr. Shamanta, one
Nahi.
question.
And the effect lasts for 3 hours. That's what he told.
No, 1 second. Dr. Swapnil and Venkat sir, just maybe a theoretical question or maybe a this thing. Now you are cleaning the nose and mouth, but the virus is going to come out from the lungs.
Yes.
Because you are only cleaning the nostrils.
Agreed. So the idea is not to kill the virus completely. Idea is to reduce the virus load.
Contagion.
The virus load, whatever you are going to get it. So we are trying all sorts of things to prevent it. It's not the panacea of like you do it and you will be free from virus. It's not.
You are not making yourself 100% safe. You are trying to make it as safe as possible.
As safe as
Reduce the viral load also.
Trying to make it safer.
Reduce the viral load is also a main concept.
Yes.
Yes,
Even in fact, the same way, steam inhalation has been advocated for this.
Dr. Shamanta, there's a question which, from the audience which I would want you to take up. How do you examine oral lesions in the OPD?
That's a very good question.
Yeah, oral lesions. Yeah. For that, you of course depends on the length of the examination. So the diktat is that you need to, the exposure has to be for as short a time as possible. So that is the number one thing. And secondly, you need to be protected with the, you can go for an N95 and a face shield. That should suffice for most cases. Yes.
And ask the patient to wear the face shield. I mean, you can ask the patient to wear a face shield, sir, while examining an oral lesion.
I had a patient, a 87-year-old gentleman, all comorbidities, blood pressure, sugar, and coronary bypass, and he is a severe pain. He has gone to 10 doctors. He is not happy. He said somebody recommended that you go to him. He will try to do something. He has a lesion on the lateral border of the tongue, which was looking like an early stage of CA, needs a biopsy. So I was not prepared to take all these precautions to do a biopsy in the oral cavity. Requested one of my friend, an ENT surgeon, and told him that this gentleman needs all these things. You are practically in a hospital or a medical college where the facilities and equipment and better prepared. Requested him and sent him there. So sometimes, nowadays it is difficult. However, honestly, we try to practice. Sometimes we may have to pass on.
Plus, it is also important to perform hand hygiene both before and after such an examination, close examination. That is that is applicable not only for the healthcare worker, also for the patient.
Can I answer that question on oral examination?
Yes,
Sir.
sir, please.
See, there are two ways. One is the patient takes a video with his camera in selfie mode. It's fairly good. Patient has to move it in all directions. The second one, if you want to do it, this is what C.R. Srinivas has suggested. You use a selfie. That will give you social distancing. And at the other end, the camera is there, and then you can see it on the screen. So this also you can do. Third way is you can design a box like what we have done for our procedures with a complete sealed silicone sheet kind of a thing. And then you put a hand inside, torch, and then see the patient. This has been done by ENT surgeons. They have made a small enclosure where the patient goes and sits. And then after each patient, you clean that enclosure.
Okay.
I think somebody has also suggested binoculars.
Yes, you
But
Now,
I use binoculars, but I don't know how good it will be.
I
use
am
binoculars for outdoor
afraid
activities.
the
For this,
medical college curriculum might change. So
Yeah.
the curriculum definitely by next year some things will come into curriculum.
Okay.
Thankfully, not telescope.
Yeah, there's a question by Dr. Sudesh Chaudhary from Ahmedabad, how to treat verruca and molluscum. So basically, either you do a low free settings radio frequency with appropriate measures, or you could do a contact cryotherapy. We have done almost 1.5 hours, so we'll just wrap up in a few moments now. Before we wrap up, I just want to ask the seniors, Venkat sir and Reddy sir, how have you managed stress in this period where incomes are dwindling due to reduced procedures and this is expected to go on? Would you like to offer a few insights and tips to youngsters who the stress is a biggest factor in this era, especially for a person who has a lot of aesthetic practice or a procedural based practice?
And who have done a lot of investment. Like
Basically, we are all doctors. We are all educated. We have gone through life at different levels, different phases. We know how to handle difficult patients, and we manage our families, our hospitals, our patients, our friends. So for us, compared to any other section, it would be easier. And also the financial matters rests on each individual patient's setup, their backup support, and all these things. For me, my setup was a relatively new setup. And even though it is a big setup, by nature, I'm not somebody who invests extravagantly. I'm always cautious. Even in this new setup, I have not invested as much as it looks like. But still, my cost of running this was around 12 to 13 lakhs per month. But in March, we were almost through. April was closed. May onwards, the staff got reduced. I spoke to them. We have reduced the salaries by maybe 30%, 40% like that. My income is zero. My family income is zero. But the rest of the things we are trying to manage, and everybody, all the staff, doctors understand and cooperate. But I can tell you, last month and this month, we could sustain. We could sustain and manage. And I am prepared to do this maybe for 6 months to 8 months, because we have no other way. I can't dispose the clinic. I can't close the clinic. I may somehow find maybe hand loans, or as Dr. Swapnil said, some add-on loans. There is no other way. Otherwise, you have to close and sit up. And if you close, you are also incurring losses of investment what you have made. So there is no other way. Everybody is a master of the situation, and the situation, that particular situation teaches you. So it comes automatically.
May I add something here?
Yes.
May I add something here? There are 3 or 4 things. One is, first is health is wealth. Your own health is very important. So stress should not be a feature. The clinics and OPDs may be low right now, but they will get back. For all those people who are primarily largely aesthetics practice and they have less of dermatology work, this is a time to introspect and get into more general dermatology practice, because that is a sustainer at the end of the day. For aesthetic practice, those who are not able to do so many procedures, don't be worried. The exodus is going to come in as soon as the pandemic dies down. It may be another 3 to 6 months, but all the patients are going to be back. And this is a very good time for aesthetic practitioners to push and encourage mandatory home care regimens, which we know, cosmeceuticals and treatment. In fact, I'm finding all my patients' pigmentation has improved drastically because of the usage of mask and usage and no sun exposure. So you just need to keep your patients motivated and encouraged, and work will be back soon again, back to its track.
I
Venkat
would
sir.
also, yeah. I would
Yeah,
also
please.
say that we also need to regularly exercise. I devote almost 20 to 30 minutes per day for exercise. Pranayam also, breathing exercise also helps, and eating on at regular times can reduce stress. And financial experts all over the world say that you should have your salary or income of almost five times your monthly income as a spare which you should keep for exigencies. So you should build up these reserves which I have been maintaining for all these years, and this is helping me out in this crisis. So we need to be less stressful by doing regular exercises and not seeing too much of media reports, because that has a adverse bearing. Who's dying of COVID, which doctor has died of it. We keep discussing that and hearing that, and that's a demoralizing thing on our psyche. So we should avoid that.
Can I add one point?
Yeah,
please.
please.
Yes, yes.
Yeah, this is regarding the laser, sir. There is a lot of perception that this is going to be stay and one should not buy the laser. I think somebody is planning to buy a laser. This is the right time to bargain. I mean, because the companies are more desperate than you.
Yes.
You will get the best price of the machine which you want to buy. So
to maintain their running costs.
yeah, to maintain their running cost, of course.
Yeah.
Even loans will be easier
Yeah,
to
loans
get
will be easier to get
at lower rates
and at
as well.
lower rate of interest.
Venkat sir.
Venkat sir, any words of wisdom for youngsters on the
Yeah,
future
see,
of
I think
procedure?
this practice corona thing will affect different people differently, and my feeling is that there are three or four different categories. One category is those who are just passing, who are postgraduate students, or who are doing their fellowship, senior residency. They don't know what to do. So far, they could get a job with a senior, with some chain of clinic, Kaya or whatever. There was something which they could find. Now that will be difficult because most people will not hire. And then in this situation, for them to open new clinics, investments, everything will be even more difficult. Even to search a place, how do you search a place in this environment? So that is one category which will be seriously affected with a lot of uncertainty. Of course, if they have family backing, they will survive, but rest of them will find it hard. And there is no easy solution to that. Then there are people who have passed about 4 or 5 years back, who have had some kind of practice, but they have invested. They have gone in for a larger space with a higher rental, or they may have taken loans to buy machines, and they don't have yet a very good dermatology practice, particularly in metros. They may be seeing 20 patients or 25 patients, but that number will come down to 8 or 10 now, out of which the procedures are just 1 or 2 or even 0. That category again has difficulty, but they have to find a way to sustain it. Then there is somebody who is in the 40, 50s category. They are fairly well settled. They have enough reserves. They will not be affected much. Even if they have loans, they just have to tide over the crisis, like Raghunath Reddy said. And by 6 months, if you have tided over, I'm sure things will come back. Then there is a category above 60 who are running single doctor clinics. They have fairly large practices, but are now afraid of everything. Because every time you open the TV, you open the above 60, you are more likely to die. So, and
by fitness and health wise, mental and this thing, you are less than 40, sir.
but we have already had one doctor who has retired. He has just given up practice. And then there are many others who are practicing on alternate days. So you will see, and then in many corporate hospitals, the senior doctors have told, don't talk to us. We are not going to come to hospital till July or August. So they may be pushed into either a premature retirement or a semi-retirement. So it is going to affect, but important lesson here is that you have to diversify. You should not depend upon any one procedure, any one type of practice, and time to focus on dermatology, because that will give stability. It will not give huge amount of money, but it will give enough to sustain the basic thing. And then couple of other things, dermatological procedures which spring out of your dermatology, like a simple thing like potassium hydroxide. There is no dearth of fungal infections even now. You see lots of them. So you do KY smear, probably you will get the salary of one IR, one front office staff. So that way you have to think of small little things. I was telling my fellows that I'm now thinking like what I thought, how I thought when we started, we passed out in 1990. We didn't have any other procedures. So we were only thinking of these simple things. So that's what is happening. Then of course it is pharmacy. Anybody who has a decent practice should open a pharmacy. And that pharmacy will sustain a significant extent because you are going to earn about 30% from there. So a pharmacy is a must for anybody who has a practice of more than about 30, 35 patients. And quite a lot. So by doing this, if you can sustain a few months, and I think afterwards, all things have to come to an end, and even this COVID will come to an end.
Dinesh, just a wisdom of advice for all those youngsters who are. I've been saying this for the past 15 to 20 years from the day I passed out, because I used to do all procedures. I used to go to all workshops, and people used to say this, that, and all. But I have always maintained and persistent that clinical dermatology should be your forte, and all basic procedures you should do. And then depending upon the need, necessity, keep expanding your practice, add other things like lasers and all. This is how it should be built up. But unfortunately, of late for the past 10 or 7, 8 years, it is like constructing the top floors first and then constructing the base. So that should not, and this is a lesson. So you have to open a clinic. You have to have your own patient base to feed for procedures, instead of going for social media, begging and spending money to get those patients. So this is the time where we have learned the standard wisdom, the well-known wisdom is always a gold standard.
Yes, sir. Just a quick question, a brief word from Dr. Shamanta. Dr. Shamanta, like, since you have a very busy OPD practice in your hospital, do you face any resistance from your residents with regards to procedures, or you keep them motivated? Because we have had instances where residents have refused to do procedures or carry out duties.
No, so I think I have been very fortunate to have all the cooperation and support from the residents at our hospital, in fact. And in fact, being the frontline COVID warriors, so to say. So, you know, we support them in all possible ways, not only with the and other equipment, but also with the mental support that they need to tide over whatever problems that they must be having at their duties.
Dinesh,
yes, sir.
If you are not doing anything, if you are pushing them, that problem comes. Yeah. If you are leading with the example, you are taking them along and being with them, then that problem will not come.
Yeah, just because Savita is the young star of the panelists here. Savita, for your age group, do you have any particular advice for the stress? Especially women, because you multitask a lot, family, job, in a college, then practice.
Yeah, during the lockdown, most of us have limited ourselves to be proper housewives, looking after kids and managing everything. But yeah, I think women handle stress slightly better because we are already used to this.
Significantly
That's slightly better, much better.
Significantly better. It's not slight.
We can give equal amount of stress also.
Yeah.
Yes.
That is also significant.
This is nice.
Just one thing, Dr. Sudesh.
I have seen women are more brave and courageous than men. But as Dr. Shaina said, they take it back.
So the incidence is low in women also, no, only 30%. Versus 65% men are infected. So we can still go out and work.
Yeah. Dr. Sudesh, your question has been answered with regards to Verruca vulgaris and mollusci. We would suggest go in for a contact cryotherapy if possible, or you could even do a radio frequency with keeping low settings. So, yes, sir, I'm just answering a question of our audience.
Yeah, I'm just answering that. It should be based on the site, the size, the age, everything will come in there. What procedure is the best to choose for that particular patient? So it should be addressed accordingly.
Okay, since you told about this, what about using interstitial bleomycin? I used to use a lot of interstitial bleomycin for multiple PAMA warts.
Yes.
So can we go ahead and do that in this current
it
scenario
works
also?
wonderfully.
No, in the current scenario.
Particularly when the warts are large enough, wherein you will be able to infiltrate this bleomycin into the wart. Yes, still that is the best in the present scenario also.
Okay. I think we have covered most of the questions and most of the topics. So we've come to the end of it. If any of the panelists feels we have left out any particular topic or any particular point has to be highlighted, please go ahead and please, you want to share your thoughts. You feel something is left out, please, you can go ahead.
As I said, everything depends on that particular situation, that particular patient, that particular diagnosis, that particular procedure which demands. I think all of us are knowledgeable enough to use that wisdom and decide. One thing is, though you can't be afraid, but at the same time, you can't be complacent. Both should be balanced.
If all of us feel that everything is covered, can we go ahead and close the session? Which has been a very wonderful.
Please.
Yeah. You
evening.
you have been a comprehensive moderator.
Thank you very much.
It's been like a giants in front of me. Savita is my dear colleague, but all of you have been like a real giant.
Thank you, Dinesh. Excellent work.
Thank you.
My message to everybody is to be positive. These are very trying times, extraordinary times, really. We have to be extremely careful about what we do. But as I said, what you do depends upon what is the situation in your city. For example, now so far we have been doing everything. Now we are rethinking what we should and what we should not do. Maybe if it goes on like this, we will withdraw into a shell and may stop doing so many things that we have been doing over the past week. So we have to be extremely careful. Careful not just because of the disease, but because of the various other things that happen. The quarantine, and then the news that you don't get a bed. Fortunately, this is something which I want to tell everybody. I had moved at this point in our Vijayanagar Association. We have a small association for our part of Bangalore. So I'm in that core committee, and we said we should not depend upon anybody. So 2 small hospitals, they have agreed to give 5 beds for doctors only. So that if something happens, we can go there. Then we can find a bed elsewhere. So this is extremely important that each area has, and in fact, I had written to IMA president also. Karnataka branch IMA president has written back to me. In fact, I request Raghunath Reddy to take this up. Ravindra, he said this idea is very good that we keep at least 1 hospital everywhere in each city for doctors and families who test positive. Otherwise, it will be a pity if we have to run from place to place searching for a.
And that's happening, sir. That's happening.
So that is very, very important.
I know. Good, sir. I know morning also I read that you have written somewhere in the forums regarding, and I was prepared, but now Ravindra is not there. But as you said, locally we have to find maybe clubs, maybe.
No, the IMA president wrote back saying that he is on this job.
Okay.
Make sure that in every city something is done for doctors.
In one part of Maharashtra, the IMA has come up with a hospital which is exclusively for doctors. That is being done. So, but other parts of Maharashtra, there is difficulty.
So I think we'll leave now.
Just give me a few more moments because this is something may not seem significant, but it's a very, very important exercise. I feel I should I wouldn't take more time. It's a thanksgiving exercise. I would like to thank all of you and all the members of ACSI, but importantly, I would also like to thank the wonderful EC of ACSI, which we have been blessed with, right from my president, Dr. Reddy, our past president, Dr. Sachidanand sir, Vice President Dr. Swapnil Shah and Dr. Biju Vasudevan, my close friend Dr. Jagdish as a treasurer, and joint secretaries Dr. Pradeep Kumari and Dr. Manas Ranjan, along with Academy Chairperson Dr. Shamanta and Dr. Savita. They have been a wonderful support. It's been very good. And also I would like to thank Dr. Reddy's for being supportive of us in our educative ventures. And there are 2 people I would like to thank very much who have worked to make this program, the last 9 to 10 programs, have a good reach and a good content. That is Onkar Deshpande from the ACSI. He manages our website. He's been doing a wonderful job of managing the programs on our website. And Somanita Day from Dr. Reddy's. So she's been doing a wonderful job of coordinating and executing the work being given to us. So thank you, Onkar, and thank you, Sumarita, for all the help. You have done all these in the last 2 months. So thanks a lot.
Thank you, Dr. Omkar and Dr. Sumalita.
Thank you. All the
Thank you.
best. Good
Thank you
night.
so
Stay
much,
safe.
entire
night.
team.
Thank you, everybody.
Thank you.
Thanks.
Onkar.